very important to make sure you know your population and are have enough resources to treat all of these patients that you're seeing.
And a few years ago, you wrote a comprehensive review of wound dressing. Why do you think it's so important to be aware of the latest products in advanced wound care?
Well, new technologies are coming out all the time, and we really want to keep up on that so we can be giving our patients the best quality of care that we possibly can.
And what do you look for in a wound dressing for your patients?
I look for something that controls the moisture level, but also absorbs any extra moisture that might be in that wound so it can heal properly.
Well, Dr. Borda, thank you so much for taking the time out for us today. If you've missed any of our live programming, want to check anything out, visit medlineconferences.com/SAWC2018. You can also learn about our other products at medline.com. We'll be right back after a short break. Don't go away. Where we'll be bringing, oh, the mic just came on. Sorry. Well, where we've been yeah, it's fine. Okay. Welcome back to the Pulse, where we've been bringing you the latest industry insights in advanced wound care and tissue regenerations from experts around the globe. But right now, we're going to be switching gears and talking about one of Medline's most popular product lines, Remedy. But if you've missed any of our live programming or want to check out what's coming up next, visit medlineconferences.com/SAWC2018, and you can also follow us along on social media. You can check us out on Facebook, Twitter, and LinkedIn. But now back to Remedy. It's Medline's line of skincare products such as cleansers, moisturizers, barrier creams, antifungals, and more. But what makes them different from other skincare lines is its use of botanical ingredients. And I have with me Medline product manager Brianna Letster, who's going to be talking a little bit about Remedy and more of its special properties. So can you start off by explaining what is Remedy and the different types of products in this line?
Well, Remedy is a full line of different skincare products. We have everything from cleansers to barrier creams, moisturizers, and antifungals. And all of our products are made with natural vitamins and minerals that are really great for the skin and really protect the skin and moisturize it. so that we can prevent different types of wounds.
And you did touch on the botanicals, so there are special botanicals in each of these items. So what made Medline think to use botanicals in this line?
Well, botanicals are something that have been highly researched in the field, and they really have properties that can aid in skin healing and skin health.
And what botanicals are in each? I know we have quite a few things up here.
We have a lot of different things in our products. We have everything from blue-green algae to vanilla and different products that have come from natural resources and can moisturize the skin.
And when and how can Remedy be used to treat those and prevent those common skin conditions?
Well, our antifungal line can really aid in patients that would need something like that. And we also have barrier creams that are great for people with fragile skin, and it protects them from the elements during the winter and keeps that skin really moisturized.
I think we should go ahead and try some.
Yes,
do you mind?
Definitely. So this is our Remedy moisturizer, and it comes in a scented and unscented version.
Awesome.
So we'll put some on there.
Well, it feels great. And you
Yeah.
actually, our live studio audience has their own Remedy on their chairs. If you want to check that out, try it out for yourself, feel free. And you said this comes in fragrance free. This does smell awesome, but okay, great. And then for sensitive skin,
Yes.
it's okay?
So all of our products are great for sensitive skin, even our scented versions, because we have natural scented properties so they won't harm the skin.
Yes. So like here. Yep, that looks good. We're gonna have a lot of product on this one, just like lined up.
Yeah.
It's gonna be a lot.
Should I pull that out to show them?
Do you want us to pull it out? No. Okay.
Oh, well.
Nope.
There.
Okay. There you go. Yep, we will do that. Okay, cool. Well, thank you so much, Brianna, for joining us and telling us a little bit more about Remedy. For those in our live studio audience, you can also check out more Remedy products over right in our booth. But thank you so much for joining us. We'll be right back after a quick break. That one was not good for me. Yes, can we try it again? Sorry. We're going to take some of these out. I don't know. Let's just put them like this, I guess. Powder? Oh boy, okay. How's that? Something like that. Yep. Yes. Welcome back to The Pulse. I'm Caroline Mattis with Medline, and you're watching our live in-booth news program from the SAWC Spring Conference in Charlotte, North Carolina. For the last 2 days, we've been bringing you, watching at home, and those in our live studio audience, expert interviews from experts around the globe in advanced wound care and tissue regeneration. But right now, we're going to be switching gears and doing a product demonstration of one of Medline's most popular product lines, Remedy. But if you've missed any of our program for the last 2 days and today, visit medlineconferences.com/SAWC 2018, and you can also follow us along on social media. Medline is on Facebook, Twitter, and LinkedIn. But now back to Remedy. It's one of Medline's most popular product lines in a line of skincare products such as cleansers, moisturizers, barrier creams, antifungals, and more. What makes them different from other skincare lines is its use of botanicals. And I have with me Medline product manager Brianna Letzer, who's going to talk a little bit about this line of products. So thank you so much for joining us, Brianna.
Thank you for having me.
So can you start out by explaining what is Remedy?
So, Remedy is a full line of skincare. So we have everything from cleansers to barrier creams, antifungals, and moisturizers. So all of those products have different properties for different types of patients.
And what makes it so different than the other types of products that are out there for people?
Well, we've done a lot of research in the different types of botanicals that you would need to find in moisturizers to have them be as effective as they can in treating different types of skin conditions.
And you just touched on the use of botanicals. So what made Medline look to botanicals?
Botanicals have really great qualities for the skin, and we've done a ton of research into why those botanicals are really great for moisturizing and protecting the skin.
And I see quite a few colors here, so I'm assuming that means it's different types of products for people. So what kind of botanicals are in each?
So we have a color coding system for all of our products, and green is for cleansing, purple is for moisturizing. They're all for a different, they're all color coded for a different reason, and so they all have different botanicals based on the type of product that they are.
Oh, and so when and how can these products be used to treat and prevent common skin conditions?
Well, our barrier creams are great for that. With people with sensitive skin, you can put that on and it protects the skin from different elements. And then also the antifungals can be used on people with wounds that need to be treated and skin that may have fungus growing in it.
So I think we should go ahead and try some out.
Yeah, definitely. So here is our moisturizer. So we're gonna
Great. Take a little bit. Okay, so it feels great, and it also has quite a smell, and it smells
Yes.
great, but does it come in fragrance free?
Yes, it does. So our fragrance version, it has all natural scents. So it can still work on sensitive skin, but for the people who want a fragrance-free version, we also have that option.
And it's good on that sensitive skin.
Yes, definitely.
And those in our live studio audience, we actually have some Remedy on your chairs. Feel free to check that out for yourself. But that's all the time we have in this segment. Thank you so much, Brianna. If you want to check out what's coming up next, visit medlineconferences.com. If you want to learn more about Remedy, visit medline.com. We'll see you right back here after a quick break. That went a little bit better. And I needed Remedy, so that helped. I needed lotion. Do you need me to move that even farther up, like when we display it?
I'm gonna wipe those off.
That was okay. 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 I'll just hold them over for longer than I think. I'm like, I'll just do it. It's fine. Oh, thanks. Okay, next. Jim McGuire. Oh boy. Where the... Oh. Welcome back to The Pulse. I'm Caroline Mattis with Medline, and you're watching our live in-booth news program from the SAWC Spring Conference in Charlotte, North Carolina. For the past 2 days, we've been bringing you expert insights into advanced wound care and tissue regeneration from experts around the globe, as well as product demonstrations from our own Medline experts. And right now, we're going to be talking about diabetes, but if you have missed any of our programming or want to check out what's coming up next, visit medlineconferences.com/SAWC2018 and check us out on social media. You can follow us along right there for all of our company news and updates. But back to diabetes. In this segment, we're going to be talking about the complications associated with the disease and what's being done to treat patients that are candidates for sharps or surgical debridement. The CDC says 21 million Americans are living with diagnosed diabetes, and another 8.1 million people have undiagnosed diabetes. That's nearly 10% of the U.S. population being affected by this disease, and the alarming complications that come with them, like diabetic foot ulcers, infections, and amputations. Diabetes is also very expensive. The American Diabetes Association found in 2017, $237 billion were spent in direct medical costs for the disease. Our next guest will dive into one possible solution for hard-to-heal diabetic-related wounds, Plurigel, the first concentrated surfactant topical to soften, loosen, and trap necrotic tissue and debris. I want to welcome Dr. James McGuire. Thank you so much for joining us.
Thank you for having me.
He is the clinical professor in the Department of Podiatric Medicine and Biomechanics at Temple University School of Podiatric Medicine. I really appreciate you being here. So can you start off by telling us a little bit about your background?
Yes. So, I went to medical school, got involved in podiatry, and I've really become very interested in different types of wound care, so different ways to heal those wounds as efficiently as we can.
And as a podiatrist, what are some of the biggest challenges that you're seeing?
Well, I see all types of wounds. I see different types of diabetic foot ulcers and things like that really pop up and are of harm to the patient.
And Plurigel is one product that you are pretty familiar with. So how does Plurigel benefit your patient population?
Well, Plurigel is a great product that we use to get that debris out of the wound. So we prep the wound and then put Plurigel on, and it pulls all of that debris up from inside of the wound so that it can heal properly.
And we are seeing that animation of what you just described right now. So how can this help solve some of the challenges that you mentioned earlier?
Well, it's always a challenge when wounds have that debris in it, because then it can heal over and cause infection. So something like Plurigel is pulling that debris out.
Thank you so much, Dr. James McGuire. We appreciate you being here. If you've missed any of our live programming or want to learn more about Plurigel, visit medline.com. We'll be right back after a short break. We're back with the latest from SAWC Spring 2018 in Charlotte, North Carolina, right here on The Pulse, where we're bringing you top industry experts and a look at research in products in wound healing. Here's a look at some of our guests you'll be seeing live over the next few hours. You can also check that out on medlineconferences.com/SAWC 2018. And don't forget to follow us on social media. Medline is on Facebook, Twitter, LinkedIn, and YouTube. You can check out, yep. Okay, let me cross this out. I'll cross it out in a second. Okay, so just send them to medlineconferences.com and thank you. The SAW, yeah, so I'll just go there. Okay. Yes. We're back now with the latest from SAWC 2018 in Charlotte, North Carolina, right here On the Pulse, where we're bringing you top industry experts and a look at research and products in wound healing. If you've missed any of our live programming, check out medlineconferences.com/SAWC and follow us along on social media. Medline's on Facebook, Twitter, LinkedIn, and YouTube. That's where we'll be getting continuous updates throughout today and also after SAWC. But right now, we want to turn our attention to venous leg ulcers and the more than $14 billion in costs each year to treat them. Joining us live is Dr. Lucian Vlad, who is an assistant professor of plastic and reconstructive surgery at Wake Forest Baptist Health. So thank you so much, Dr. Vlad, for joining us.
Thank you for having me.
Can you tell us a little bit about your background and how you got involved in this industry?
Yes. So, I went to medical school and then got really involved with wound care from one of my mentors. And I've really just been interested in the whole topic of it and how to treat those wounds properly since then.
And what is one of the biggest challenges in treating those venous leg ulcers?
Well, there are lots of challenges when treating these types of wounds. So we see a lot of patients not caring for them properly, not changing their dressings. And so we really try to give them a specific protocol of how to heal that wound properly.
And what trends are you seeing in your high acuity patients at Wake Forest Baptist Health?
Well, I've seen a lot of different trends going on in the wound care industry, and I've seen those all in my patients.
Can you tell us about a time where you've needed an innovative product like Hyalamatrix to help treat a patient?
Well, Hyalamatrix I use on my very complex wounds. So wounds that we've tried other things, they didn't work, and now we need to go to a more advanced product. Hyalamatrix has a very specific chemical makeup that really helps with the wound healing process in a lot of my patients.
How is Hyalamatrix ultimately beneficial for the outpatient setting, like your practice and the patient population that you have provided care for?
So, Hyalamatrix has been great in helping those patients heal a lot of wounds. We've had a lot of people who were close to amputations, and we found Hyalamatrix and used that on those wound beds.
And diabetes rates have nearly doubled in the past 20 years, leading to many ulcers you're seeing. So how do you balance treating patients every day while still seeking new treatment options?
So, it really is a time management thing. So we have all of our patients in our clinics that we really need to treat and make sure they're okay, but we also need to make time for learning about new technologies so we can heal those patients that we do have in the most efficient way.
Dr. Vlad, thank you so much for being here with us. If you want to learn more about Hyalamatrix, visit medline.com. Don't go away. We'll be right back after a short break. Yep. For Pleural Gel, correct? Okay. Pleural Gel. Hello and welcome back to The Pulse. I'm Caroline Mattis with Medline, and right now we're reporting live from the SAWC Spring 2018 conference in Charlotte, North Carolina. For those of you watching at YouTube on home, thank you so much for joining us, and to our live studio audience, thank you so much. For the last 2 days, we've been bringing you industry expert insights into advanced wound care and tissue regeneration, as well as product demonstrations from our own Medline experts, and this segment is no exception. If you want to check out everything that we've done for the past 2 days or what's coming up next, visit medlineconferences.com/SAWC 2018, and we are also on social media. Check out Medline on Facebook, Twitter, and LinkedIn. And right now we're going to be talking about burns. According to the American Burn Association, nearly 500,000 burn injuries require medical treatment each year, and experts say the deeper the burn, the more difficult to heal. Today we're joined by Dr. Paul Glatt, a plastic surgeon with more than 20 years of experience with treating burns and wound care. Thank you so much, Dr. Glatt, for joining us.
Thank you for having me.
And you've described plastic surgery as the last frontier in general surgery, so tell us why.
So, it really is that last wound healing process that we see in plastic surgery. So, we are healing the wound from the beginning, but then at the end, when we really need to see that full coverage of the wound, that's where we come in.
And we know that burns are complex, and I'm sure you do too, but what do you think people don't realize when it comes to treating them?
People don't realize that they need to have the full continuum of care to fully heal that wound. So, the wound bed prep and all of that is very important, but then we also need to look and make sure that that wound is not going to break open again and need any more surgeries.
And let's put ourselves in the patient's shoes. Management of burns can be very difficult for patients. What are some innovations and solutions you've tried to help with patients from a clinical perspective?
We've tried a wide variety of different products on our patients, to make sure that they really do have that full healing process.
And why is it crucial to continue innovating in this space, especially for those dealing with burns?
Well, it's so important to keep innovating because these patients still experience a lot of pain, and we really want to make the wound healing process as quick and pain-free as possible.
Dr. Glatt, thank you so much. You will be right back here in just a couple of segments, so make sure you join us again. We'll be talking again with Dr. Glatt. And thank you so much for joining us. Join our conversation on social media. We're on Facebook, Twitter, LinkedIn, and YouTube. That's all the time we have for this segment. I hope to see you right back here in just a few minutes. OptiCell is next. I only have join. Hello and welcome back to The Pulse. This is where we've been bringing you front row seats to expert insights and product demonstrations from our own Medline experts. If you've missed anything, you can check out medlineconferences.com/SAWC, and you can also find us on Facebook. Medline is also on Twitter and LinkedIn. So thanks for those of you watching on YouTube and sticking with us. So now we're going to be taking a closer look at a product called OptiCell. What is it and what makes it so special? Well, I have product manager Madeline Adam here to tell us exactly that. Thank you so much for joining us, Madeline.
Thank you for having me.
So I see a lot is going on here. So what is OptiCell?
So OptiCell is a wound healing dressing. It comes in dressing form and a ribbon form, and it is made from chitosan, which is actually made from crustaceans. And this fiber actually gels up when it is in the wound, so it controls the moisture levels and makes for that optimal wound healing environment.
And so can you talk a little bit more about the technology within OptiCell that makes it so special?
So I mentioned that chitosan, it is derived from crustaceans under the sea. We also have a silver version. So silver has antibacterial qualities that can really aid in that wound healing process as well.
And you mentioned crustaceans. So what made Medline think to look to the sea and to crustaceans for this product?
Well, there's been a lot of research done, and we found that that was the best quality for our different types of dressings to heal the patients efficiently.
So it sounds like OptiCell helps with more than just proper moisture balance.
Yes, it does.
So can we go ahead and see the demo?
Yes, definitely. So here is a sheet, and we're going to put OptiCell on this square and our competitor on this square.
Okay.
And we're going to squeeze that, the same amount of saline on each dressing.
Okay.
And if you see pretty quickly that the competitor's dressing shrinks up about 30%.
Yes.
While our dressing stays the same size. This is very important because when you're covering that wound, you want to make sure that none of the wound is exposed.
Okay. I can definitely see the difference between these two products. And moving on to the ribbon?
Yes.
Okay.
So here are the two ribbons. We have our OptiCell ribbon and then our competitor ribbon. And when I squirt the same amount of saline on each product, you can also see that OptiCell does not shrink up,
Okay.
while our competitor does shrink up a lot. The other quality of the ribbon that is very special is we have this backing on it. So
Okay.
when it is being pulled out of the wound, it won't break apart. And if you tug on this one, you can see that it is pretty strong. If you pull it really hard, it will break, but you have to think about the strength you'd be using when you're pulling that out of a
So this
wound.
will eventually break, even though I
Yes.
do feel a bit of resistance here.
Okay, and then here is our competitor ribbon.
Okay.
And do you feel the difference in
Yes.
that? And how
This
the
one's a little
different
bit-
debris can pull out and be left into the wound.
Yes, absolutely. I do feel a difference. That's so interesting. And I do see the difference in the sizing too. So it's retaining its shape on the
Yes.
OptiCell. Well, thank you so much for showing us this demonstration, Madeline. Thank you so much. And if you want to check out more about OptiCell and learn more, visit medline.com. We'll be right back after a short break. Hello and welcome back to the Pulse Medline's live in-booth news program from the SAWC Spring Conference 2018 in Charlotte, North Carolina. I'm Caroline Mattis. Today we've been discussing some unique insights and trends in advanced wound care and tissue regeneration, and this segment is no exception. If you've missed any of our previous programming or want to check out what's coming up, I'm not saying what's coming up next, sorry. If you want to check out our previous programming, visit medlineconferences.com/SAWC2018. Now we want to talk to you about the use of chitosan dressing with silver for the management of burn wounds. The American Burn Association says that roughly 450,000 patients receive hospital and emergency room treatment for burns each year, and these burns are sometimes painful. It can be concerning, especially when patients can run that risk of infection. Opticell AG Plus is a chitosan dressing with silver that can be used to overcome some of those challenges. Today we have Dr. Paul Glatt again joining us on the Pulse stage about his experience with this wound dressing. So welcome back to the stage, Dr. Glatt.
Thank you for having me again.
So can you tell us more about your background? I know you touched on that a little bit earlier, but for those joining us right now.
Yes, so I work in the wound healing industry, in burn care specifically. And so, I got into that from the different mentors that I've had and the research that I've done.
And can you tell us what drew you to this field?
Yes, so I was really interested in burn wounds because they're so complex. They're very difficult to heal in a lot of times. And so I really have liked to see how I can more efficiently heal these wounds.
What do you look for in a good donor burn site or donor dressing?
So, we really look for those properties that are really going to heal the wound as quickly and as efficiently as possible.
How does the chitosan and silver found in Opticell AG Plus aid in the burn healing process?
Well, the chitosan helps keep that optimal wound healing environment, the moisture levels, and then silver has antibacterial qualities. And so that silver can also be used to prevent infection in that wound.
And what about Opticell's application makes it different than other dressings?
Well, Opticell is a dressing that when put onto the wound bed gels up, and so it really conforms to the wound bed.
Thank you so much, Dr. Paul Glatt. That's all the time we have for now. Thank you so much for joining us throughout SAWC right here at the Pulse. If you want to learn more about Opticell, visit medline.com. Hello and welcome back to the Pulse. I'm Caroline Mattis with Medline, and you're watching our live in-booth news program from the SAWC Spring 2018 Conference in Charlotte, North Carolina. Today and every day of SAWC, we have been discussing some unique insights and trends in advanced wound care and tissue regeneration. If you want to check out our past interviews, check out medlineconferences.com/SAWC2018, and you can also follow us along on social media even after SAWC. We're on Facebook, Twitter, and LinkedIn. But now we want to talk about the use of a chitosan dressing with silver for the management of burn wounds. According to the American Burn Association, roughly 450,000 patients receive hospital and emergency room treatment for burns each year, and these burns are sometimes painful, and patients can run that risk of infection. Opticell AG is a chitosan dressing with silver that can be used to overcome some of those challenges. Right now we're going to be speaking with Dr. Paul Glatt about his experience with this wound dressing. Thank you so much for joining us yet again, Dr. Glatt.
Thank you for having me again.
For those of us who have just joined us, can you tell us a little bit about your background?
Yes, so I work in the burn industry, so I help heal a lot of different types of burns and do reconstructive surgery on them.
And what drew you to this field?
So I was really interested in it all from medical school and all the different burns that I saw in my clinicals, and I really wanted to find the best ways to treat them.
What do you look for in a good burn or donor site dressing?
So I look for something that really gives the optimal moisture balance. So I really want to find something that is going to create the best wound healing environment.
How does the chitosan and silver found in OptiCell AG Plus aid in the burn healing process?
Well, the chitosan, which is derived from crustaceans, really helps with keeping that moisture level at the right spot. And then silver has antibacterial qualities, so that would really help prevent infections in the wound.
And what about OptiCell's application makes it different than other dressings?
So OptiCell is a dressing that will gel up when it is put on the wound, so it really conforms to that wound and helps in the wound healing process.
Thank you so much, Dr. Glatt. We appreciate you coming back to us. Thank you so much for joining us right here at the Pulse throughout all of SAWC. If you want to learn more about OptiCell, you can visit medline.com.